Good afternoon, everyone. This is Dr. Armstrong. My voice is a little scratchy today, but we wanted to cover something today that came to my knowledge that I feel is not discussed enough in the world of psychology, and it is a technique that is a very, very useful technique and a technique that can help many people overcome some of the challenges that they are facing along their healing journey. So, what we're going to be talking about today is CPT therapy. CPT therapy. It is a specific type of therapy based on the cognitive behavioral therapy module designed primarily to treat post-traumatic stress disorder and other related conditions as well. One of the main things of CPT therapy is to help you process through your trauma. What we do is a mix of psychological and even some life coaching techniques to help you matriculate through your trauma and find the healing that you need. Okay? So, number one, and we're going to go through some specific terms here. Number one would be the stuck points. CPT, a central concept of CPT, is the idea of a stuck point. These are what we consider maladaptive beliefs or thoughts that individuals might have after experiencing a traumatic event. For example, a person may say, well, it's my fault that I got attacked. I shouldn't have been doing this. Or I can't trust anyone. Or any type of belief that can hinder the individual's ability to move forward. We even see this in children, teenagers who have gone through very traumatic childhoods, experiences in childhoods, and they often find fault in maybe a parent, a friend, or even themselves. Okay? Number two, cognitive restructuring is a major concept of CPT therapy. This is a process by which individuals learn to identify and challenge the stuck points. Okay? In everyday language, it's like learning to catch yourself, right? Because what we think is what we say, all right? And when we have certain thoughts, they become our actions and they become our behaviors as well. So, cognitive restructuring, a process by which the individual learns to identify and challenge the stuck points. In everyday language, it's like learning to catch yourself when you're thinking negatively or inaccurately about the trauma that has occurred in your life. Okay? Trying to get through these rather quickly here. These structured points, structured sessions. Okay? It is typically conducted over a course of 12 sessions, and we have a technique and a science behind how we do this. Okay? Then there is the homework part, which I'm going to combine two right here, writing and reading. A core component of CPT therapy involves writing a detailed account of the traumatic event and reading it aloud. Reading it aloud where you can hear yourself, not just your inner voice. Okay? This may involve worksheets or practice in real life situations, or even guided discussions by us as the therapist, okay? And then the homework goals. Like many cognitive behavioral therapies, CPT often involves a homework assignment. The homework is really for you to discover your thought pattern and your thought process. It is a very integral part of the processes of healing, so that you won't revert back to those stuck points. Okay? So that you won't revert back to those stuck points. And then we have the overall goal. The overall goal of CPT is to help individuals with a post-traumatic stress disorder and related conditions reduce their symptoms by addressing and restructuring maladaptive beliefs about their trauma. Over time, this can lead to a very, very beneficial way of challenging the negativities that come from your trauma. Of course, we know all trauma is negative, but there comes a time when we have to outgrow the trauma, okay? And we have to process through. So many times we go through the trauma, but we don't process through them, all right? It's just like a child going through elementary school, middle school, a child going through high school, and then going into college. After going into college, it's all processing through, all right? And it really helps with the flashbacks and the avoidant behavior, as well as heightened arousal and anxieties. All right? When you can stop and process right there in the moment and say, hey, this is not the trauma. This is me thinking. All right? These are the things that cognitive processing therapy can help you with. It's not talked about a lot, which it should be. However, Dr. Armstrong is going to start using a lot of this. So I want you to please, if you're in any type of traumatic situation, reach out to me, because this will be a model that I'm going to incorporate a lot more of in my therapy sessions with my clients. So listen, folks, thank you for listening. I know it's a quick one today. To get the commercial out the way, like, subscribe, and share. I do appreciate it. Thank you so much. Have a wonderful day.